morning, everyone. Today we are beginning our journey into the heart of what keeps a society functioning, the public health. We will be looking at different chapters of this book, authored by Mary Jane Schneider's text. And today I discuss the chapter 1, and this chapter divided into two parts. The part one focusing on the intersection of science, politics, and the crucial concept of the prevention. And the part two, we will continue this topic. Before we dive into the history and theory, let's establish the vocabulary we will be using throughout the semester. On this slide, we see our first set of pillars. Notice assessment and assurance. These are not just administrative words, they are core functions. We also see biomedical sciences, reminding us that public health is rooted in hard biology. Also, we find epidemiology, often called the basic science of public health. We also see the intervention and the prevention. The prevention, there is three levels of prevention: primary prevention, secondary prevention, and tertiary prevention. Understanding the difference between these three is vital for your midterm, but more importantly, for your careers in the field. Now, let's put these terms into a real world context. Introduction to civilized living. Living conditions will be basically healthy unless something unusual happens, like cryptosporidium outbreaks in Mulawaki water. People assume they are basically safe. Most people do not wake up and worry if their tap water will kill them or if their aspirin is actually poison. We take this safety for guaranteed or granted. This invisible safety is the primary goal of a civilized society. But this sense of security is actually a very modern luxury. Historical context, 19th century. If we travel back to the mid of 1800s, or I can say mid of 19th century, the statistics were grim. Two or three out of every 10 newborn infants never reached their first birthday. Only 3 of 10, 3 of 10 just children could expect to live past the age of 25. The death was a constant, visible companion in daily life. What were the primary killers back then? The tuberculosis was the great white plague on top of infectious diseases. The Industrial Revolution brought horrific workplace hazards. Epidemics of cholera, typhoid, and smallpox swept through communities, killing all ages and causing fear. Often fatal injuries to workers in mines and factories were common. Hazards include unsafe equipment, long working hours, poor lighting and ventilation, and child labor. There were no safety nets and very little ventilation in factories. Reasons for improvement. It was not just luck. People's lives are generally healthier today than they were 150 years ago for multiple reasons. It was cleaner water, better sewage disposal, and improved nutrition. More knowledge concerning healthy and unhealthy behaviors has contributed to the improvement. Most of these factors fall within the domain of public health. Many people credit modern medicine, but as we'll see, it was actually public health measures that did the heavy lifting. This brings us to how we actually define this field. Defining the public health concepts. Public health is two things. Concept one, it is a state of being healthy as a population. And the concept two, it is the set of measures we take to ensure that state. It's both the goal and the work. And who is responsible for doing that work? The role of government in the public health. While non-profits play a role, the government is the primary actor. Only the government has the authority to mandate clean water standards or regulate the safety for the entire nation's food supply. The government's reach extend into our daily behaviors as well. From school immunization to traffic laws, the government uses its police powers to protect us from each other and from ourselves. It also funds the research that tell us how to stay healthy. Even with these clear rules, the public often struggles to define what we do. The challenge of comprehending public health. A 1999 survey showed that over half of Americans did not really understand what public health meant. They often confuse it with publicly funded medicine. For a poor, it's much broader than that. To clarify this, let's look at the classic definition from a century ago. Winslow definitions in 1920. Charles Edward Winslow defined it as an art and science. Note his emphasis on organized community efforts. Public health is not something one person does, it's something we do together. Winslow vision led to decades of unprecedented success. The decades of success and complacency. By the mid of 19th century, we were so successful at beating infectious diseases that we became complacent. We thought we thought the battle was won and public health faded into the background. However, the 1980s provided a rude awakening. awakening. Suddenly, we were hit with the AIDS epidemic, rising pollution, and social disease like drug abuse and violence. It became clear that our system was decaying from neglect. This crisis led to landmark reports that redefined the field, the future of the public health. There was a sense public health was unprepared for a new problem, partly because we are not viewed as public health issues. The 1988 Institutes of Medicine report is the Bible of modern public health. It warned that our public health is in disarray. It forced us to create a new functional framework. That framework broke public health down into four parts. The four parts definition, mission, and substances. The mission is to assure conditions of health. The substance is to organize effort. We are moving away from just treating and toward assuring that the environment is safe. And the other two parts deal with how we are organized and what we actually do. The organizational framework include the government and private partners. But look at these three core functions: assessment, policy development, and assurance. Memorize these, they are the DNA of public health. Let's break these three functions down into 10 specific services. The 10 essential public health services. Another committees later translated the three core functions into a concrete set of activities. These are known as the 10 essential public health services. They provide a clear breakdown of how assessment, policy development, and assurance are uh, executed in practice. These 10 services provide a checklist of any health department. If you are not doing these, you are not fully protecting your community. The first category is assessment. Assessment is about data. We monitor health status, like tracking a flow outbreak, and we investigate hazards like a lead contaminated water sources. Once we have the data, we move to the policy development. This is not just about making laws, it's about educating the public health and mobilizing partnerships. We can't solve obesity, smoking without the community's help. And finally, we have assurance category. This is where the rubber meets the road. Are the law being enforced? Do people have access to doctors? Is our workforce actually competent? This is about guaranteeing results. And the 10th service ties it all together. Research is the foundation. We are constantly looking for new insight because without research, our policies and assessment would be based on a guesswork, not science. This is the end of the part one of the chapter one. See you in the part two and goodbye. Thank you.